Hi, I am Dr. Zeyan Liew from UCLA Department of Epidemiology. On behalf of my co-authors, this is a video abstract that presents our article published on Epidemiology entitled Prenatal Use of Acetaminophen and Child IQ in the Danish National Birth Cohort. Acetaminophen, also known as paracetamol, is one of the most commonly used over-the-counter medications by pregnant women, mainly to treat pain or fever in pregnancy. Currently, it is considered safe for pregnancy use, but in fact, very few studies have evaluated the potential long-term consequences of fetal exposures to this common medication. What we know is that acetaminophen can cross the placenta barrier and expose the developing fetus. Recent animal studies suggested that this medication exhibits endocrine effects with the potential to interfere with fetal brain development process. In the last 2 years, there are 3 independent epidemiological studies reported the associations between maternal use of acetaminophen and childhood neurobehavioral disorders such as ADHD. In this article, we aim to examine the potential effect of acetaminophen on child's cognitive functions such as intelligence. We analyzed data for about 1,500 mothers and children pairs that were enrolled part of the Danish National Birth Cohort. Exposure information was collected prospectively in 3 telephone interviews by the mother, 2 during pregnancy and 1 shortly after birth. Child IQ scores was measured at age 5 by trained psychologists using Wechsler intelligence scales. We conducted multiple linear regression analysis adjusting for a range of potential confounders, in particularly maternal IQ and indications for acetaminophen use, such as maternal fever, infections or inflammations, and musculoskeletal diseases in pregnancy. Our most interesting finding was found when we analyzed both the exposure and indication of use together. In particular, we found that acetaminophen use and maternal fever were both associated with lower child IQ scores. For example, here in Figure 1, you see that maternal use of acetaminophen associated with about 3 points lower in performance IQ among those without reporting fever. However, there were also 2 to 4 points lower in IQ among mothers who reported fever but did not use acetaminophen. And these associations became less apparent among mothers with fever and had taken acetaminophen. Here is another way to look at the data by estimating the exposure effect stratified by indication of use. Here we see that the effect estimates for acetaminophen use on child IQ appears to be positive among mothers reporting having fevers, but the estimates are in the negative directions among mothers reporting other indications of use. We also found that increasing days of fever, or the maximum temperature of fever, associated with lower child IQ scores only when the mothers did not use acetaminophen. In terms of timing of exposures, we found that among mothers without fever, a stronger negative effect of acetaminophen on child IQ appeared when the mother used acetaminophen in the first and second trimester of pregnancy. In summary, in the Danish cohort, we found that prenatal use of acetaminophen and maternal fever in pregnancy were both associated with reduction of child IQ scores at age 5. We also found that taking acetaminophen may counter some of the negative effects of maternal fever on child IQ. Some strengths of our study included a longitudinal design and a relatively large sample size allowing for subgroup analysis, and then we were able to control for a wide range of potential confounders in our statistical analysis. Some limitations we should address. First, due to the structure of data collections, we were actually uncertain about the exact timings or the occurrence of maternal fever and the use of medications. Secondly, we cannot rule out the possibility of uncontrolled confoundings that could have explained some of the associations we observed. Third, we did not have adequate information on the exact frequency and the dosage of acetaminophen use in pregnancy. Finally, This is novel findings, and replication of our results are needed. Thanks for watching the video, and I hope you enjoy reading our article.